Sage here for Kalkine Media. Please subscribe to the channel and press the bell icon to be notified of the latest videos. Vaccination visibly helps in abating existential threat to life. The size and extent of the coronavirus pandemic has been quite rough and humongous so far in almost every country. And no matter what age group you belong to, we have apparently seen the severity of the after effects of the COVID-19 SARS-CoV-2 virus in almost every individual, while a large section of people who contracted coronavirus have already succumbed to death. It is no surprise why all the governments, regional authorities, central drug administrators, hospital jurisdictions, various departments of health and other healthcare bodies are pressing and encouraging the people to receive their COVID-19 jabs when they are called for it. And according to the latest study conducted by the Public Health England, the COVID-19 inoculation program alone has helped in preventing more than 11,000 deaths in England. And over the months-long course of the still-running vaccination program, there have been quite a few adversities with the people who have either received a single jab or have completed the 2-dose regimen. While on the other hand, the vaccination has clearly steered the healthcare authorities in saving thousands of lives in the span of nearly 5 months, the data released by the PHE suggests that the available immunisation options, the Oxford University and AstraZeneca vaccine and the Pfizer-BioNTech vaccine, have collectively helped in averting as many as 11,700 lives, that too only in the people of more than 60 years in England up until the end of April. There had been long-ranging discussions and murmurs when the Medicines and Healthcare Products Regulatory Agency, MHRA, in a first gave approval to the COVID-19 vaccine co-developed by the Germans BioNTech SE and America's Pfizer for emergency usage. Various medical experts initially believed that there could be severe issues with the people who have received the COVID-19 vaccines, and the so-called formation of blood clots in the people who were administered the AstraZeneca vaccine surfaced across, developing a potential fear amidst the individuals that somehow disturbed the vaccination pace. The individuals who have prepared themselves to get vaccinated suddenly changed their decisions even after repeated iterations from the MHRA and the company producing the vaccine itself. The ever-expanding scale of the vaccination program in the United Kingdom has blatantly demonstrated a noteworthy victory in the battle against the coronavirus pandemic. And as per a separate weekly analysis done by the PHE, the hospital admission rate has subsided even further in the 18th week of the present calendar year. And the data indicates that the rate of hospitalisation stood at 0.85 per 100,000 persons, as compared to a gigantic measure of 37.20 per 100,000 individuals in the first week of 2021. By and large, available options of COVID-19 vaccines have considerably supported lives in a big manner that was seemingly anticipated by many, but initially looked slightly blurred when the Department of Health and Social Care started rolling out the vaccines according to the priority list advised by the Joint Committee on Vaccination and Immunisation, or JCVI. And during the earlier days, the cumulative effect of the vaccine was yet to be realised, as it takes a whole lot of effort to vaccinate the people to the preference set by the JCVI, as all the people were not readily available near to the vaccination centres. And COVID-19 vaccination has undoubtedly bolstered the confidence among the people, as the prospective benefits and advantages of the available jabs are relatively way higher than the possible chances of adverse effects associated with it, and the fact which was initially dictated by the respective vaccine makers as well as the approving authority. And however the enthusiastic effort of the track and trace services being handled by the National Health Service, or NHS, restrictive environment and other pandemic-induced curbs imposed by the government are duly entitled to receive a mention, as all the aforementioned activities and guidelines have somewhere or the other helped in minimising the spread and thereby lessening the burden on the hospitals and healthcare departments to work more efficiently. The inaugural study conducted by the PHE has also indicated that the vaccination drive has assisted in forestalling at least 33,000 hospital admissions of people within the age group of 65 years and above in England during the corresponding period. The data has been backed by clinical evidence which backs that the COVID-19 immunisation program has been highly effective in avoiding the people seeking hospital admissions, especially old age people. So far, the inferences have been drawn on the basis of people receiving the first jab as a part of the two-dose structure of COVID-19, and the PHE is likely to publish the impact of the second dose of the COVID-19 vaccine. Thank you for your time watching, and if you like this information, please like, share and comment on the video below and subscribe to the channel. Press the bell icon to be notified of the latest videos, and for regular information and further updates, please head to the website kalkinemedia.com. And this is Sage for Kalkine Media.